these injections, they're a little bit like jump-starting your car. So your car's stopped, your battery's flat. They help you jumpstart. But then you need to understand, well, why did it stop in the first place? Is the battery problem? Did I leave the lights on? And then you need to make sure you get your car working so you can keep going. So are you going to change your diet and eat well? Are you exercising properly? Is it emotional? You know, I know sometimes when I get stressed, I do turn to food, and other people do as well. So you have to address all those factors for this to work well. So that's what we need. We need that wraparound service to go with the injection. And then that's how you see effective change.
It could be life-changing for someone in a serious health crisis.
Yes, it certainly could. And I have, we've been able to prescribe it for some of our diabetic patients who were struggling to get on top of control with them. And for some of them it has. You know, I've seen their journey and but they have been motivated and they've done the side work. You know, they've looked at their diet, they're better with their exercise, and you can see the benefit to them.
That's a real risk, that in this rush to get their hands on it, people are buying stuff online that pretends to be these drugs and is anything but.
Yeah. So there are, certainly there are private providers, and there's some who are excellent, some less so. And then there are people who aren't healthcare professionals who may be selling like fake drugs or, drugs that are not used in the best of manner. And we've had people with side effects from that, with issues. So just be careful. If you're putting something into your body, you need to make sure that it's, the right thing for the right reason. You've been advised in the right way to do it. So yeah, get proper medical advice.
Is there a possibility that people who start to take this might just have to stay on it?
So at the moment, the recommendation is 2 years to stay on it, to get, as long as you're getting the right kind of weight loss and you have the wraparound care. I think the thinking is that if, when you're on it, you do get better with what you eat, you do get better with exercising, with looking after yourself, then when you do come to that point, you're able to carry on without it. But I think it'll be interesting to see where we are.
Do you get a sense that a lot of people are prepared to do that hard work? Because almost the jab is the easy bit, isn't it? Changing lifestyle, eating a bit less, eating better, exercising. That's the hard bit.
Yes, yeah.
This is a wonder drug only if it's done in conjunction with all the other stuff.
Yeah.
But do you get a sense that people, or certainly the patients you see, are prepared to do that?
So you're right, that is harder to do. And, for years, people have struggled with weight and how do you make all these changes and then keep to them? Because often we're great, we have a few months where we're losing weight, everything's like sailing along, and then, you hit something and the weight comes back plus extra. So I think, yes, people have to be prepared to do the work. But, obesity isn't just us and choices we make. It's the environment and the places, right? Things like town planning, how food is advertised, what can you afford?